It's easy to use QuickVet. To start the instrument, push the button on the back. The instrument starts up, and you will be asked to remove the sealing cartridge. As you remove the cartridge, you will be presented with 4 test options: coagulation for feline and canine, blood typing canine DEA 1.1, and fibrinogen for equine. Measuring fibrinogen, you need plasma from a whole blood sample collected in a citrate tube. The blood collecting tube must be filled to the appropriate level and gently inverted a few times to ensure proper mixing of citrate and blood. For obtaining plasma, you should centrifuge your blood at a minimum 7,000 G-minutes. Enclosed in the fibrinogen cartridge box, you will find a buffer vial. Remove the cap. Use a fixed volume pipette to extract 100 microliter plasma from the citrate test tube and transfer it into the buffer vial. Mix buffer and plasma using the pipette by extracting and aspirating into the microvial. Ensure that the tip is emptied fully after each cycle. Replace the cap on the microtube and invert the tube a few times. Now your preparation is done and you are ready to measure the fibrinogen level of the sample. To start testing, push this button. The fibrinogen test pouch contains a cartridge and a pipette tip. A buffer vial is included in the pack. Insert a fibrinogen cartridge. When prompted for the cartridge code, type the code found on the front of the cartridge pouch. You can add information about the patient by using the on-screen keyboard. You have the option to enter both patient name and sample ID. You will be asked to confirm that you have prepared your plasma for testing according to the requirements. After the cartridge warms to 37 degrees, you will be asked to deposit the sample into the well. Remove the cap from the vial, and using the fixed volume pipette, extract 100 microliter of sample and deposit it in the cartridge well. Once the sample is deposited, the test starts automatically and you may follow the progress on screen. While the test is running, let's look into how it works. When a plasma sample is loaded into the cartridge, the reagent is dissolved and initiates the fibrinogen to fibrin conversion. The QuickVet analyzer monitors the dynamics of the conversion process by calculating the fibrinogen concentration. This is based on the measured loss in light transmission through the microfluidic reaction chamber. When the instrument beeps, the test has been completed, and results can be viewed on the display. On the screen, you can read not only the fibrinogen level, but also the normal fibrinogen range for horses. This enables the user to determine if there is a higher or lower fibrinogen level than normal. Fibrinogen is an acute phase protein that is widely used as an inflammatory marker in horses. Low levels of fibrinogen may indicate a potential bleeding and/or liver problem. Quick and accurate diagnosis is essential for successful outcome of treatment. Elevated levels of fibrinogen in horses indicate a degree of systemic inflammatory response. Increase in fibrinogen concentration is related to the magnitude of inflammation and often occurs before clinical evidence of disease. You can print the result by pushing the print button, or go back to the menu screen under History and see up to 1,000 samples you've previously measured. Remove the used cartridge from the analyzer and discard it.